Good afternoon. This is August the 24th, 2020, special board meeting of the County Supervisors. Madam Clerk, can you do a roll call, please?
Supervisor Johnson?
Here.
Supervisor Gould?
Here.
Supervisor Watson?
Here.
Supervisor Angus?
Here.
And Chairman Bishop.
Okay. Thank you very much. Our first item of business will be a discussion of possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19, updates, and taking any necessary actions based upon these updates. At the podium, we have Denise Burley, our Public Health Director, and I will turn the floor over to her. Good afternoon.
Thank you. Good afternoon, Madam Chair, members of the board. So I will run through my numbers as I usually do. We've had 3,448 cases in the county to date. We have 2,385 recovered, 185 deaths. Average age of cases is 48 years old. Average age of deaths is 76.1. We experienced a 27% decrease in cases from the previous week. 2 weeks ago, we had 159 cases. Last week, we're posting currently 116 cases. So a very significant improvement, as you can see, definitely progress. And I want to thank all the people out there who are using masks, social distancing, and taking all those measures that are helping reduce this number down. And they should all take credit where credit is due. Are there any questions on the actual numbers?
I see none.
Okay. All right. Supervisor Johnson had requested some information on professions. So as we had mentioned before, we added this question after the fact to the questionnaire for investigators. So right now, the percent of cases that we have analysis for is about 16.5%. As we continue on, we'll continue to collect that data and present it back to you as we see that it's changing dramatically or not. Initially, just so that you're aware, the information was collected if they were in a high-risk occupation. So if they were in the healthcare field, child care, school, long-term care, assisted living, correctional facility, government officer, law enforcement, they were asked that question at that time. So we did add some other occupations, of course, into that questionnaire after Supervisor Johnson requested that. And what we're showing is about 30% of the cases fall in the healthcare field. 20% are in sales and service, 19% food industry, 12% casino, 7% manual labor, 5% government worker, 1% schools, although at this point we know schools have been out of session and are just starting back up. So that information will be important moving forward. Any questions on the professions? Supervisor Johnson, did that meet your needs as far as seeing the professions and having that information? And I can actually provide you with the chart that I have as well.
That would be great. Thank you. Yeah, I think it gives us some ideas. I guess I was surprised that the
I'm sorry, Supervisor Johnson, I can
other than that,
just barely hear you.
I guess that helps out quite a bit. Yes, if you could send it to me. I was kind of surprised at the low number for casinos.
Yes, right. Well, as you know, many of them were closed for some time also. So that may have impacted those percentages somewhat.
Sure.
Okay. All right. I wanted to provide an update on testing for you. HHS did get back with us and approved the 3 testing sites that were selected and the dates that were selected for testing in Bullhead City, Kingman, and Lake Havasu City. So those testing dates as they're set right now, and I won't give the specific locations yet because I don't know that we've got them confirmed, and I don't want to give out inaccurate information. But right now what we have is in Bullhead City, testing will be conducted Thursday, September 10th from 7 to 11 a.m. and Saturday, September 12th from 7 to 11 a.m. And we just received this confirmation, so it's hot off the press. And there'll be 1,000 tests available for those 2 days. For Kingman, we've got Friday, September 11th from 7 a.m. to 11 a.m. and Saturday, September 12th from 7 a.m. to 11 a.m. And then in Lake Havasu City, we have Sunday, the 13th of September from 7 a.m. to 11 a.m. and Monday, the 14th of September from 7 a.m. to 11 a.m. And again, each one of those sites, there's 1,000 tests available for that event, for that particular day.
Denise, is that 1,000 for
I'm sorry, it's 1,000 for
total?
total for each city, not for each event. So if you looked at each event being a day, we have 500 for each day, 1,000 total for each of the cities.
Thank you.
So as you're aware, North Country Healthcare conducted their testing in Lake Havasu City on Saturday. I don't have full information on that, so I hesitate to give you any kind of statistics or approximations, but we have requested that information, and we'll get back with you as soon as we have that available, including number of tests that were performed, positives, negatives. I believe, and if you can hang on just one second, I can clarify this. Kyle, was it anybody who wanted to be tested? Okay, so it was community-based testing, not symptomatic individuals only. And then also that it was held in the morning to try to, encourage people to go early and stay out of the heat. So that'll be a continuation, but we'll have more information as we get that through the door.
Denise, do we have a time for the results to return?
They said 3 to 4 working days, so business days, and so hopefully we'll have those by the Thursday meeting, if not sooner. The HHS...
I have a question, Madam Chair.
Oh, go ahead, sorry.
Supervisor Johnson, go ahead.
Thank you. Maybe you don't have the information, or maybe you don't want to give it out because it's not a verified number. What I was getting was maybe only 50 people took the test. Is that something like you were hearing?
Yes, yeah, Supervisor Johnson. What I heard was maybe that 50 people registered, and then somewhere in the low to mid 40s showed up for the testing and participated in the testing. But again, that's not information that I have confirmed at this point. But yes, that's what I've heard.
I think maybe, I don't know if our messaging, how we would change that, but to begin with, some people were putting out, well, the more people you test, the more positive you're going to have. And then now we're saying we need to have more people test so we can lower the positivity. So we might want to look at how we do our messaging on getting people to show up.
Right.
That's all.
Right, yes. And North Country did a majority of the promotion, and I think the city assisted in that as well. And Supervisor Johnson, you may be able to speak more to what kind of advertising was available in your community. But yeah, I think those are all concerns.
Madam Chair,
Supervisor Angus?
just for clarification, you said that 50 signed up and then only 40 out of that 50 showed up, or 40 more than what was registered?
So of those 50 that registered, pre-registered, they had less than 50 show up
Really?
for testing. Correct.
Yeah, I'm not surprised at that. But we had either somewhere between 150 or maybe 200 tests. You weren't clear on that last week.
We had 150 tests available for that day.
Wow, okay,
And the same will be for the Bullhead City testing site this Friday.
okay.
Okay, so Denise, remind me, I think the messaging that a lot of the people were hearing from various sources was that the testing was giving false numbers, and that may have something to do with people not wanting to test now. Is that the way you understand what's been going on as far as the messaging?
Well, I think I just have a lot of anecdotal information, more so, Supervisor Bishop, in that I haven't heard it that way, that the information isn't correct. And if you're referring to a test result being inaccurate, I haven't heard that. PCR testing and the type of PCR testing that they are performing, that diagnostic testing, is very accurate. So, and the turnaround time for receiving results has decreased dramatically. I think there's also individuals who are now thinking, okay, I don't feel well, I'll stay home and I'll follow the protocols. So you also have a certain subset of the population that getting sick that are just following the guidelines that are laid out for people in terms of their isolation and quarantine times.
Actually, what I was referring to was people were under the impression that if they tested and they were positive, well, then our positive numbers would go up, and
Correct. Correct.
it would look bad for the communities.
Well, you know, I think we go back to that percent positivity question. I mean, if you're only testing symptomatic people, that would be the case. But if your testing is community-based, if it's open and you're testing anybody who wishes to be tested, then that percentage is not as dramatically affected by that, those testing events, because you're making sort of an assumption that without just testing positive people or symptomatic people, that actual percent positivity would go down slightly. And I apologize, I meant to tell you up front that I have Mayor Schumacher on the line in case we have data questions along the way, because I know we made a number of changes in our data points and information that we're sharing with you and the public, and I just want to make sure that if there were specific questions directed towards that I could, if I was unable to answer them, that I'd have somebody available to do so. So I
thank
want to
you.
be up front there.
Madam Chairman.
Yes, go ahead.
Denise, do you think the fact that someone that feels that they have had COVID in the past were to test, the test would then show them positive, then they would get quarantined for 14 days, and their family would be quarantined for additional 10 days, might keep them from wanting to test?
Well, I don't think I can speak for people per se, Supervisor Gould, but I could certainly see in my own mind how that might affect my decision. But being a public health professional, of course, I'm about trying to make sure that we have accuracy and that we're seeing what's real, what our real prevalence rates are in the community. So I can certainly see that. I think it also depends on whether or not they were previously tested and whether or not that previous testing was done in the last 3 months if they were positive. So I think that piece where you have some of the virus still in your body if you tested positive, and that continues on for up to that 3-month time frame, or through that 3-month time frame, can certainly affect people's decisions and impact that.
Also, I did not see any advertising for the testing blitz in the Lake Havasu City area.
Okay.
Thank you, ma'am.
Supervisor Johnson, did you happen to see any advertising down in that area?
I believe the city put out a press release on it. Part of the problem was that people I think the cutoff was Wednesday. So when, how people sometimes are a little slow in getting the information and deciding to take it up on it, the registration had already been closed 3 days before the event.
Got it. Yes, understood. We will do more on our end to promote the Bullhead City testing event that is this Friday. So we've already had conversations about that this morning and talked about the messaging and so on. So we will try to get information to, certainly to Roger, and also on our Facebook page to do some promotional outreach that way. Okay, the Embry Women's Health testing, we are still waiting on some firm information from them. We have not received that yet, so as soon as we have more concrete dates and times and so forth from them about start, I'll make sure I get back to you. The goal for Embry Women's Health is to be a constant source of testing in the community, not just a blitz-style testing. So their long-term approach to this, I think, will also benefit the community, so that if people feel sick, they know they can go and get a test. It's going to be hopefully much easier for people to get that. But they also test asymptomatic individuals and anybody who wants to get testing. So they do have a community-based testing approach. So again, once we have more information, I will make sure that I present that out to you and share that with you. Supervisor Gould, you brought up convalescent plasma, I believe, last week, and I responded with some information that we had then, which of course has changed seems to be a regular occurrence. So the U.S. Food and Drug Administration issued an emergency use authorization Sunday for the use of convalescent plasma for the treatment of COVID-19 hospitalized patients. So that was a new development as of Sunday. And as we again learn more about its use in our community, we'll make sure that we share that out with you if the hospitals are sharing that information with us. Any questions there?
I have a quick question
Supervisor Angus, go ahead.
about hospitalizations.
Yes.
So the numbers we got in the last several days, I mean, they've gone way down, the number of hospitalizations. In fact, I received an email, I'm not going to give the specific numbers, but the WARMC reports the lowest number of inpatient COVID since, I believe, beginning of May. So we are definitely on the right direction, especially with the numbers. And so how does that factor into how the state views our numbers? Do they take into consideration at all those hospitalization numbers?
Yes. I mean, those are definitely part of the school and the business benchmarks and the COVID-like illness and hospitalizations. So I do think they're seeing that relief within the hospital systems and improvements there statewide, and also we're seeing that locally. Okay, so I don't have any other particular updates, but I did want to make sure that we addressed all of your questions and concerns related to the fact sheet and the other information that's being added into the website. So if you have any feedback, I'd like to collect that and make sure that we've captured and changed that data to be more reflective of what you wanted to see.
Does anyone have any changes or comments on the website or the fact sheet? Looks like we're good, Denise. Thank you very much.
Okay, all right, cool. If at any point that changes, please let us know, and we'll look at what we can do to make those modifications, okay?
Madam Chair.
Supervisor Angus.
I just wanted to ask a question. I've been asked to ask this question. Down in, I think up here, the county building has gyms in it. Are they closed here? They're closed here.
Yes.
Down in Bullhead, I was asked about the new probation,
Yes.
because according to the order from the city, county and federal buildings are exempt.
I believe, County Manager Elters, would you be able to speak to that? I believe you addressed that before, about the gym in Bullhead City specifically, but throughout the county.
The gym in the new gym in the probation building in Bullhead City.
Madam Chair, Supervisor Angus, we did look at all three gyms that we have in the county and took the approach that we need to be consistent with what we expect the public to do for the public in the public gyms, as well as knowing that all three gyms are in county facilities. So we did put out information to county employees indicating that all three were closed until further notice. We felt that it would not look good to have the gyms in county buildings open while the private gyms were not having that opportunity. So as of today, the direction is that all three are closed until further notice. I don't know if I answered your question.
Is that a decision that was made at the administration level, or is that part of when we voted for mask mandates in county buildings? Was that part of that? Who made the decision is my point.
Supervisor, the decision was based on the direction that the board took to mandate masks and such in county buildings, and knowing that we did not have the tools to go sanitize after every person who used it, the directive came from the county manager's office that all three would be closed until the board gave different direction, or until the private gyms had an opportunity to put a plan in place that allows them to open, and we would reconsider at that time.
Okay, well, I'd like to make a motion that we open up the gyms in the county facilities with the caveat that the people using it will be on an honor system to clean up after themselves, that we could provide the sanitation, but they will clean up. I don't know how many people use it. I don't think it's that many, and I think that they are responsible enough to do that. So that's my motion.
Okay, we have a motion on the floor. Ryan Esplin, do you have anything to add?
I have some concerns. I'd have to look again at the executive order to determine whether we could do that or not. I don't know the applicability to the county, but I think the rationale that the county manager stated, if the gyms throughout the county are closed in accordance with the executive order, we ought to follow suit. Our recommendation is to not approve this motion. Until we get more information, I would not do it at this time. And I respect the position that Supervisor Angus has, but at this time I can't recommend it.
Thank you. Any other comments?
I second Supervisor Angus's motion.
Any other comments? Supervisor Watson?
In your motion, are you recommending any distancing?
I don't know what the gym looks like. Maybe we could put the equipment 6 feet apart, or we can make those accommodations, or maybe limit the amount of people who could be in it. Because again, like down in Bullhead, you're not going to have that many people. There are just few. So maybe you could say only 2 at a time. How's that sound? Even 1 at a time. I think they'd be happy with anything. That's a good idea.
I think, if we limit the number of people using it and they clean it after they're gone,
Right.
I've got no problem with that.
Okay, so 1 or 2. What do you think?
I'll go for 2.
Okay, so I'm going to amend my motion to opening up the gyms in the county buildings and limiting to 2 people at a time, and make sure that they sanitize the equipment when they leave.
Supervisor Angus, you said 2 people at a time. I'm assuming you mean employees?
These are our gym is only open to employees.
Okay, just wanted to clarify that.
Madam Chair, Supervisor Angus, it is open to employees and spouses.
Okay, so it's same thing, 2 at a time. That's all.
And,
Yeah, it's not open to the general public.
and Chairman Bishop, if I could just add to this, I have concerns. Our recommendation is to follow the executive orders of the governor, and it is not our recommendation to go against what the governor has stated. There's a procedure in place. Now, again, admittedly, and I'm being honest, I don't know if the executive order applies to county gyms like this. I'd have to look. But even if it did not, we still do not recommend that you take this action.
I heard you the first time, and I'm going along with my motion.
Okay,
And I second Supervisor Angus's motion again.
okay, thank you, Supervisor Gold. Mr. Esplin, could there be any legal ramifications if this motion is passed?
It will depend on whether it violates the executive order. Anytime you're disobeying a legal order, there can be consequences. I don't know. I'd have to look at the executive order to determine the applicability to a gym in a county building. I don't know that answer.
Okay.
If this was a private business, it'd be a different story. It's clearly you have to follow the executive orders. But here, I'd have to determine whether it applies to a county gym in a county building. If it does, yeah, there could be consequences. If it does not apply, then you're correct. It would not.
Is our
Researched and more clarification by the next COVID meeting?
I can do that, certainly.
Okay.
the executive order is to businesses. It's a business, the gyms, bars, and restaurants. This is not a business. It's a room with some equipment in it.
I have to look to see what the executive order says. I don't have it in front of me.
You can look, but let's, I made the motion and I want to continue with it.
Okay. Is there any further discussion? We have a motion on the floor. It has been seconded by Supervisor Gold. Okay, let's do a roll call on this one.
Supervisor Watson?
Yes.
Supervisor Angus?
Yes.
Supervisor Johnson?
No.
Supervisor Gould?
Yes.
Chairman Bishop?
No.
Motion carries.
Okay.
I didn't have any other, I'm sorry.
Okay, and before we end here, I also want to report that we had a meeting. It was called sort of last minute by Regina Cobb, our state representative, and in attendance were Denise, myself, Regina Cobb, Senator Sonny Borelli, and Representative Leo Biasucci. Dr. Kara Christ came, and it was called because of the business, gyms and bars and restaurants, and to let them know of our concerns in Mojave County, just like what we were talking about, how our numbers, we believe, are falsely skewed. We explained it to Dr. Christ, who graciously said she understood and that she was going to go look back at the numbers and see what she can do. She said some of their hands are tied for some legal problems. I believe that that lawsuit from the gym actually kind of maybe hurt more than it helped. And so they're seeing how they can do that. But the direction looks to be that they're gearing towards allowing these gyms and whatnot to open. We do have our gym owners here who are very upset and are about to go out of business. So we're just trying to help them along. But I did want to, on the record, thank the state and Dr. Christ for taking this meeting, listening to us, and understanding how we believe that our numbers are going to keep us down. And if they keep it up with the metrics that they put together for opening schools and businesses, it'll be months because of the lag time for everything that we've talked about in the last couple of weeks. Hopefully it will be rectified. We're looking forward. I believe the governor's having another press conference on Thursday, and hopefully we'll see some changes there.
And Supervisor Angus, while you were discussing things, I just looked up the executive order that we're talking about, Executive Order 2020-43. And again, I'm just trying to do this on the fly as quickly as I can. And it says, notwithstanding any other law or executive order, effective at 8 p.m. on Monday, June 29th, the following establishments shall pause operations unless extended, because it was supposed to be till July 27th. It was then subsequently extended. And it says indoor gyms and fitness clubs or centers. It doesn't specify businesses or not. So it's an unknown question of whether it applies to the county. But it's still, my recommendation, it remains the same.
I understand.
Sure. I just wanted to answer that question.
Madam Chairman.
Go ahead.
On July 2nd, the Board of Supervisors instituted the mask mandate in county buildings. There were exceptions for people with health issues. Then we came back on July 16th and added face shields for those that could not wear a mask. It's being interpreted by staff that people with medical conditions that can't wear a mask nor a face shield are then asked to leave the building. I don't believe that that was the intent of the change on July 16th that allowed face shields also. And we need to clarify that before we get ourselves in a bind with the federals on the ADA regulations.
Supervisor Gold, it's my memory that if you had a medical exemption, you did not have to wear a mask. You would be offered a shield, but otherwise you could remain. That's what I understood.
Madam Chair.
County Manager.
Well, I heard from a constituent last week that she was asked to leave the library in Lake Havasu because she has a medical condition that she cannot wear a mask, she cannot wear a face shield. She was then asked to wait outside, which I believe violates the federal law for disabled people, the ADA law. And if you read the directive from risk management, that's how it reads.
Madam Chair.
Matt.
Let me see. I've got several people wanting to speak. County Manager Elters, I'll let you go next.
Madam Chair, Supervisor Gould, the practice that we have in place is that we would, based on our understanding of the board action and direction, we would ask an individual who is not wearing anything to wear a mask or facial cover. If they indicate that they have medical conditions that prevent them from wearing a face mask, we would ask them if they would wear a face shield and offer that to them. If they do refuse or indicate that they cannot wear it or would not wear it, then we would offer them to serve them through phone or computer to facilitate the services that they need done, and including carrying, in the case of the library, carrying books or other supplies out to them. All in an effort not so much to refuse them service, but to facilitate getting their services done while complying with the board direction. And if they decline all those options, then the employees are left with no other option other than to decline serving them. That is the practice that we have been using, and we believe that is consistent with the board direction.
Okay, Supervisor
Madam
Johnson.
Chairman,
Was that you, Supervisor Gould?
it was.
Yeah, if you could just say your name first, then I wouldn't get confused between you and Supervisor Johnson. Go ahead.
Thank you, Madam Chairman. Sam, I believe that policy is in conflict with the Americans with Disability Act. They're entitled to have service the same way that an able-bodied person would have service. And I remember an exception that people were still allowed to conduct business even if they weren't wearing the face shield.
And if I may answer that, Supervisor Gould and Chairman Bishop?
Yes, Mr. Ryan, go ahead.
Sure. Supervisor Gould, I appreciate you brought up these points. First off, the Mojave County complies with the Americans with Disabilities Act. We looked at the complaint that was issued recently by the library, and Mojave County complied with the Americans with Disability Act, and we continue to comply with the Americans with Disability Act. As you pointed out, according to the Americans with Disability Act, we have to provide the same service that we provide to any person, regardless of their disability. And we ensure to do that. In order to comply with that, what we do is we first have the requirement that we have a mask. And we provide that mask for people. If they don't have a mask, we provide it for them. If they don't have a mask, then we say, well, we offer a face shield. Here's a face shield. Here's an opportunity for you to comply, make sure that we're providing safety for our employees and for the public. Here's a face shield. If they also cannot use a face shield, then we provide other services, just like what the county manager pointed out. We provide it by telephone, by email, all kinds of different ways in order to ensure that they have all the services that an able-bodied person would do. At some point, we can say, you know what, we've provided all the possible things. We've given all kinds of reasonable alternatives. We've provided all kinds of reasonable accommodations. At some point, it can come to the point where we can say, no, we cannot provide further services. That is because during this incident, during a pandemic, this poses a risk where we can do that. There are exceptions that would allow it. And that is one of them. The EEOC has come out specifically in the context of employment about the risk that COVID poses to others in the employment context, which is similar to what we're talking about here. It's a little bit different context, but it's ADA, different sections of the ADA. So that's kind of the legal side of it. But now to your question, Supervisor Golden, to the board here can clarify that position right now. Any board member can make a motion to say, okay, here's our position. We require masks, we require face shields, and if somebody has a medical exemption, we will allow them in the building as well. You have the power to do that right now, and you can do that today. You can clearly do that today. One thing I will also add to this, Supervisor Gould, is this. My understanding of the ADA is completely different than when it was back in February of this year. If you would have asked me this question back in February of this year, I clearly would have said, oh, absolutely, we couldn't do this. But so much has changed with the pandemic, even with the laws related to the pandemic, that it is completely different than when it was our understanding of the ADA 6 months ago. And so to look at the ADA as it was in February versus what we have today is a completely different model. So just keep that in mind as well. From us, my recommendation to the board is make a motion, clarify it right now. You can do that, and then staff will have the direction. We're trying to do whatever the board wants, and we will implement that. And my recommendation is to clarify that. Thank you.
Okay. Any other comments?
Madam Chairman.
Supervisor Gould?
Gould here.
Go ahead.
I move that people with health issues that keep them from wearing either a mask or a face shield be allowed to enter and use county facilities.
Can you please repeat that?
Madam Chair. I move that people with a medical exemption that prevents them from wearing a mask or a face shield be allowed to access and use county facilities.
I'll second that.
And I'm sorry, I'm going to keep on talking here. I try not to talk so much, but if I may, Chairman Bishop.
Yes, please do.
The one other thing you got to be aware of too is, and we've had this issue before, just so you're aware, the court buildings, our courts are separate. They are getting directives directly from the Arizona Office of Courts, the AOC, and their directions are going to be different than what we're giving. And so your motion, I'm just going to say, is not going to apply to the courts, just so you're aware of that.
Okay.
Madam Chairman, I'd like to amend my motion. I amend my motion to exempt the courts from this motion.
Okay. Supervisor Watson?
My concern is our employees, and how are we going to make sure that there's enough social distancing between the person that's coming in without any protection and our employees? That's really my only concern. If we can somehow add that into your motion for their certain amount of distance to make sure that that occurs, or that there's absolutely no contact or interaction closer than the 6 feet recommended by our current services, well, that's my question.
Okay, and I also have a question. Are we going to ask for any kind of written documentation of what this medical exemption is?
Chairman Bishop, if I may interject again.
I don't think we can do that.
Our
but-
recommendation is you not ask. Please, our recommendation is you not ask for any kind of documentation as to any kind of medical issue or disability.
Because that might be a violation of the privacy laws.
Correct.
Okay.
Well, of the ADA.
Supervisor Watson?
Madam Chair.
So I guess if I decide to come into the premises without a mask, then no one can ask me if I've got a medical situation that deters that, then I can't ask that question. Is that right? Or I
We
cannot
can.
be asked that question.
So the litany of questions would be, here, we have a mask for you. Can you please provide one a mask? The person says, no, I have a medical disability that prevents me from wearing a mask. Then we end the inquiry. We end the conversation. But certainly we can ask them, can you please wear a mask? Or we have a mask policy here. If they say, I have a medical disability or a medical issue that prevents me from wearing the mask, then we stop the inquiry at that point.
Okay, and I don't know, I believe all the supervisors received a request from Banner Health requesting that we support the universal masking in every county of our state. I just wanted to recognize that this letter did go out to all of the board members. And I'm not taking a stance one way or the other, I'm just doing a public.
Madam Chair,
Yes,
may I?
yes, go ahead, County Manager.
Again, it's not It's not to take a position one way or the other. It's just to provide a reminder that shortly after the executive order and the delegation of authority to local agencies, all 3 cities within the county, and that is Kingman, Bullhead City, and Lake Havasu City, came out with proclamation mandating masks. We discussed that with the board at a board meeting. The understanding was that the city government does not have jurisdiction over county government, therefore those did not apply in county buildings, and the feeling was we have concerns. The number of cases were high and were getting high, were increasingly going up. So the board felt the need to mandate that at county facilities, not countywide, and it was multiple motions by the board that were voted on that got us to this point and this protocol that we have been using. So again, I'm not taking position one way or the other. It's not up to me. It's up to the board members. I just wanted to remind you of that process that led us to this point.
Okay. Denise, do you have any comments?
I do not. I feel like the board is making their decision, and we will follow whatever directive the board gives us.
Madam Chairman, Gould here.
Supervisor Gold.
I'd like to amend my motion yet once again that people allowed into county buildings will do the best of their ability to maintain the 6-foot social distancing.
And I amend my second. Yeah.
Madam Chair.
Supervisor Johnson.
Thank you, Madam Chair. I can't believe we're going over this for this length of time. The person in question who filed the complaint with the county, I had Mr. Esplin give them a legal opinion. We handled all of their concerns. What you're asking now is for the people who want to flout the mask to just come in and say, oh, I have a doctor's order because we can't ask. We make every accommodation. What we're trying to do is protect our employees and protect the public at the same time. I believe we should not be changing the policy we have in place at this time. That's all, Madam Chair.
Okay. Any further discussion? Okay, Madam Clerk, we've had several changes here. Are you clear as to what the motion is, and can you read it back to us? Or summarize it as best you can?
Madam Chair, motion is people with health issues be allowed to enter and use the facilities without a mask or a face shield if they state that they have a medical issues. It exempts the court buildings, and it also has now been amended to maintain social distancing where all possible for the people who are not wearing masks.
Okay, thank you. Okay, let's call for the vote, please. Can you do a roll call?
Supervisor Watson?
I'm going to continue to err on the side of safety for our employees, so I'll say no.
Supervisor Angus?
Yes.
Supervisor Johnson?
No.
Supervisor Gould?
Yes.
Chairman Bishop?
No.
Motion does not carry.
Okay, Denise, do you have anything else?
I do not.
Okay, are there any other comments or questions for Denise?
I have a question, Madam Chair.
Go ahead.
Thank you. I'm not sure if all the other supervisors received the information, but I'd ask about cases that were not followed up on, and we were informed that information was lacking that we received. It appears that we've had over or nearly 400 cases of incomplete information. The Arizona State Laboratory has given us like 95 that were incomplete, Sonora and Quest and Phoenix 93, LabCorp Phoenix 65, Kingman Regional Medical Center 34, Western Arizona Regional Medical Center 18, Havasu Regional Medical Center 11, Peach Springs was 11. Then we had some doctors that weren't doing it. So just for everybody's information, that's only about 10%, but that's still too high. That's all I have, Madam Chair. Thank you.
Okay, thank you.
Madam Chair,
Supervisor
I
Angus?
just received another question from a constituent. Here it is. Is convalescent plasma treatment available in Mojave County? Supposedly the best results when used in first 3 days after diagnosis. They said it shows a 35% decrease in deaths, but not for people on ventilators.
Right. At this time, I don't know the answer to that question, so I'd like to follow up and get that information to you.
Okay, thank you.
Certainly.
Okay, going on to item number 2. Approve the intergovernmental agreement contract IGA 2021-044 for COVID-19 complaint referrals between Arizona Department of Health Services and Mojave County Department of Health, and approve funding in the amount of $25,000 from Arizona Department of Health Services to fund addressing complaints received by the Environmental Health Division of the Public Health Department of identified permitted establishments noted in the executive orders that are failing to adopt, adhere to, comply with measures to help mitigate the spread of COVID-19 through education strategies. So, Denise, is there anything else you want to add to the way the item is written?
I just want to make sure that I emphasize that this is really about technical assistance and education for those businesses that are looking to follow the executive order. And so we would follow up with our complaints as we do currently, and then provide the technical assistance and ensure that they have the executive order and the business requirements for that specific business, and then ensure that we're following up with them and taking those necessary steps. But it does not include an enforcement action within that contract, and we will continue to just, again, focus our efforts on education and technical assistance related to the executive order and their business requirements.
Okay.
Madam Chair.
Does anyone have any questions or comments?
Madam Chair.
Go ahead.
Thank you, Madam Chair. My question is for the clerk of the board. Was it just me that didn't receive any backup on this? I couldn't find any backup.
Madam Clerk?
Madam Chair, Supervisor Johnson, no, it is posted to the website. I can resend you the link if you'd like.
I looked this morning and couldn't find any backup at all for it. Thank you.
Okay, we'll have the clerk of the board send you the backup information, Supervisor Johnson. And I believe she's doing that as we speak. So did we want to take a 5-minute break so that we can get this accomplished and give Supervisor Johnson a chance to read the information? Okay.
Madam Chair, I'm going over it now as we're going through it. I just hadn't seen it this morning when I looked. No need to delay.
Okay. Are there any other comments or questions? Okay, I'll entertain a motion.
Madam Chair, I'll make a motion for approval.
I'll second.
Okay, we have a motion and a second. Supervisor Johnson, do you need any more time?
No, ma'am. Thank you.
Okay, all those in favor say aye.
Aye.
Any opposed?
No.
Okay, motion passes. Item number 3, this will be a discussion and possible action to ratify the declaration of fire emergency signed by the Board of Supervisors Chairman Gene Bishop on August 20th, 2020, due to the potential threats posed by the Ridge Fire in the Hualapai Mountains and the continued high hazard fire conditions across the county.
Madam Chairman, I'd like to make a motion for approval.
And I'll second.
We have a motion and a second. All those in favor say aye.
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 Any opposed? Okay, motion passes, and I'd just like to say with the help of our firefighters, the Ridge Fire is now 52% contained. Next item is a discussion of possible action, receive an update and obtain legal advice from the county attorney's office regarding pending or contemplated liability claims and related legal actions involving Mojave County.
Madam Chair, I make a motion that we go into executive session.
Second motion?
Okay, we have a motion and a second to go into executive session. All those in favor say aye.
Aye.
Any opposed? Okay, we will
I need everybody to leave the room, please. Except Byron.
Okay, we will be going into executive session here just shortly.
Jimmy, just so you know, I got some feedback that the technical part was terrible today. Kept going in and out.
Okay, I'll let them know.
What was the problem? Hildy, what did you find out was the problem? With your comments?
I don't know. I'm just saying that now they're having technical problems with the video.
Oh.
I don't know if the audio